Did you know that cardiovascular diseases are the #1 cause of death globally? It's a fact that underscores the importance of understanding cardiovascular health. Our heart, the vital organ that pumps life through our veins, is at the center of this discussion. It's a remarkable machine, thumping away tirelessly from the moment we're born. But like any machine, it requires maintenance and sometimes repair. The field of cardiovascular health is dedicated to understanding, maintaining and restoring our heart's functionality. One of the most common heart conditions that people encounter is angina, a type of chest pain caused by reduced blood flow to the heart. It's like your heart crying out in thirst, desperate for more oxygen-rich blood. This is where anti-anginal agents come into play. They're the water carriers, the life givers, that help quench your heart's thirst. These agents form a crucial part of our medicinal arsenal, helping to restore balance and alleviate the distress caused by conditions like angina. They have a singular purpose: to ensure our heart gets the oxygen it needs to keep beating, to keep us alive. Anti-anginal agents are not just pills or injections, they're more than that. They're the result of years of research and understanding, born from our desire to keep our hearts healthy and our lives vibrant. They're the products of science, yes, but also of hope, perseverance, and the enduring human spirit. Understanding these agents is not just about memorizing their names or knowing their chemical structures. It's about appreciating the role they play in our cardiovascular health and recognizing their significance in the grand scheme of our well-being. Now you might be wondering, what makes these anti-anginal agents so special? How do they manage to do what they do? What's the science behind their magic? Well, hold on to those questions, because we're about to embark on a fascinating journey into the world of anti-anginal agents. So, what exactly are these anti-anginal agents and how do they work? Let's dive in. Scene script. Anti-anginal agents, as the name suggests, are drugs used to treat angina, chest pain caused by reduced blood flow to the heart. Let's delve deeper into the world of these life-saving medications. First off, we have the nitrates. These potent drugs like nitroglycerin and isosorbide dinitrate work by relaxing and widening your blood vessels. This allows more blood to flow to the heart muscle, alleviating the chest pain associated with angina. Nitrates can be taken sublingually for immediate relief during an angina attack, or used as a preventative measure to avoid future episodes. Next, we have the beta blockers. They're the real MVPs in the world of anti-anginal agents. Drugs like metoprolol and atenolol work by blocking the effects of adrenaline on your heart. This helps to slow the heart rate and decrease blood pressure, reducing the heart's demand for oxygen. Beta blockers are often the first line of defense against angina, especially in patients with a history of heart attacks. Lastly, we have the calcium channel blockers. This group of drugs, including amlodipine and diltiazem, inhibit the movement of calcium into the cells of the heart and blood vessels. This results in relaxation and widening of the blood vessels, which in turn reduces the workload on the heart, easing chest pain. These three types of anti-anginal agents each play a crucial role in treating angina, working in harmony to improve blood flow to the heart, decrease the heart's workload, and prevent future angina attacks. But it's important to remember that these drugs aren't a free pass. They need to be used responsibly and under the guidance of a healthcare professional. Overuse or misuse can lead to a variety of issues, like hypertension or dangerously low blood pressure, and arrhythmias, or irregular heart rhythms. However, like all medications, these agents come with their own set of side effects. While anti-anginal agents can be life-saving, they also have potential side effects that we need to be aware of. Let's start with nitrates, a common type of anti-anginal agent. These drugs, while effective in relieving chest pain, can cause headaches, dizziness, and flushing. They may also lead to a rapid heartbeat, a condition known as tachycardia. Moreover, if used excessively, nitrates can cause a serious drop in blood pressure, potentially leading to fainting spells. Beta blockers, another class of anti-anginal agents, come with their own set of cautions. These drugs can cause fatigue, cold hands and feet, and sluggishness. In some cases, they can exacerbate symptoms of asthma or other respiratory conditions. It's also important to note that abruptly stopping the use of beta blockers can lead to a spike in blood pressure, so any changes in dosage should be done under careful medical supervision. Calcium channel blockers, a third type of anti-anginal agent, can cause dizziness, flushing, and swollen ankles. More serious side effects, although less common, include a slow heartbeat and low blood pressure. Now let's discuss contraindications. Generally, individuals with low blood pressure, severe heart failure, or certain heart rhythm disorders should avoid these medications. Pregnant women and those with kidney or liver disease should also exercise caution. Remember, it's always crucial to discuss your complete medical history with your healthcare provider before starting any new medication. Lastly, it's important to note that while these side effects may sound daunting, they do not occur in everyone. Many people use these medications safely and effectively every day. The key is to use them as directed, to communicate openly with your healthcare provider, and to report any unusual or persistent side effects promptly. Now that we have a solid understanding of these agents, let's summarize key points to remember. Anti-anginal agents play a crucial role in managing cardiovascular health, particularly in treating angina. Let's revisit the key points we've covered to ensure we've got a solid grasp on this vital topic. Firstly, we delved into the world of anti-anginal agents, a powerful class of cardiovascular drugs. We discussed three primary types of these agents: nitrates, beta blockers, and calcium channel blockers. Each type works differently, but they all serve the same fundamental goal: to alleviate the symptoms of angina and improve the quality of life for those affected. Nitrates, which include drugs like nitroglycerin, work by dilating the blood vessels, allowing for increased blood flow to the heart. Beta blockers, on the other hand, slow down the heart rate and reduce its workload, thereby decreasing the heart's demand for oxygen. Examples of these would be drugs like metoprolol or atenolol. Lastly, calcium channel blockers, such as amlodipine, disrupt the movement of calcium into heart and blood vessel cells, relaxing and widening the vessels. We also dove into the potential side effects of these anti-anginal agents. While these drugs are crucial for managing angina, they can come with their own set of challenges. Nitrates can cause headaches and flushing, beta blockers may lead to fatigue and cold hands or feet, and calcium channel blockers might result in swollen ankles and constipation. It's essential to be aware of these potential side effects, both for those prescribing and those taking the medication. Finally, we highlighted the importance of understanding these points for anyone studying or working in the medical field. These drugs are not just names and mechanisms, they are tools to improve and save lives. Understanding their workings, their benefits, and their potential drawbacks is vital to providing the best care possible. And that's a wrap on anti-anginal agents. Remember, knowledge is power, especially when it comes to our health. So we've taken a deep dive into the world of anti-anginal agents today. We've journeyed through the intricate labyrinth of the heart and its maladies, and explored how these potent drugs help to keep the rhythm of life dancing in our veins. In our exploration, we've unveiled the layers of complexity behind these medicinal marvels. We've learned how they work, not just in the abstract, but in the living, beating heart. How they soothe the anguished angina, and bring relief to millions around the world. But why is this so important? Why should we care about these anti-anginal agents? Well, the answer lies in the very heart of our being. Cardiovascular diseases are not just medical conditions. They are global pandemics, affecting millions of lives every day. They are the silent thieves of joy, the uninvited guests at the dinner party of life. And they don't discriminate. They affect the young and the old, the rich and the poor, the strong and the weak. Understanding these anti-anginal agents, then, is not just about knowing some fancy medical terminology, it's about taking control of our health and our well-being. It's about empowering ourselves with knowledge, so we can make informed decisions about our treatment options. It's about standing up to the silent thief and saying, "Not today." And so, we come to the end of our journey. But this is not the end of our exploration, far from it. There are still many more mysteries to unravel, many more questions to answer, many more drugs to discover. This is just the beginning. So, stay with me on this journey of discovery. Subscribe for more because you won't find me later. Stay curious, stay informed, and most importantly, stay healthy. Together we can make a difference. Together, we can change the world, one heartbeat at a time.